In this channel, I've always been sharing the fun side about my dogs, but this video is going to be different. Some of you may already know Kai, my 7 months old Belgian Malinois. Recently, I haven't been uploading any videos of him, and this is because he tested positive for erlichiosis, or some may call it the blood parasite. He's still fighting to recover, and therefore after I upload this video, I'm going to take a short break from YouTube to focus on him and give him the support that he needs. And hopefully in the next few weeks, I'm going to be back with the good news on Kai's update. Now in this video, I'm going to tell you guys a quick story of how it happened, and later I will also try to explain everything I know about canine ehrlichiosis, from the symptoms, treatments, based on how it happened, also the prevention. No, I'm not a vet, but this disease infected my dog, so at least I'm going to share this experience, which I think could be a very important information for you. So about 2 weeks ago, I noticed something different about Kai. That morning he lost his energy. He was lethargic and I saw him coughing several times. I wasn't quite worried because the previous day we were doing many activities and he was running and playing very hard at the field, so I thought he was just exhausted. But in the afternoon he vomited 2 times, still seemed lethargic, lost his appetite, had difficulties breathing, and didn't want to play with his favorite toy. And as you know, these are the most common symptoms that shows something is wrong with your dog. I took him to the vet, and at first the symptoms seemed that he had a respiratory infection. The vet gave him a few injections for 3 days, and at first everything seemed fine. He stopped vomiting, he started to eat, but not much. Until I noticed something is still wrong. His feet was very weak and weary. He keeps slipping when he tries to stand or sit, and the floor isn't even slippery. So I saw the lameness on his feet. He then lost 2 kilograms in a week. The other symptoms that he showed was scratching his eyes using his paws, dry mouth, saw him constantly licking his lips, and because of this, we decided to come back to the vet, and through further examinations, the vet told us that we must do a blood test and a rapid test for Ehrlichia canis. We did the rapid test first, and the result was 2 stripes. Kai tested positive for canine ehrlichiosis. Now what is erlichiosis? Erlichiosis is a disease that is caused by the bacterium Ehrlichia canis and is transmitted through brown ticks that are infected by the bacterium. It is widely known in 1970s when the military dogs, particularly German Shepherds, came back from the Vietnam War infected by this disease, which many of the war dogs had already died in the war zone. These parasites live inside the red blood cells, and because of the infection, platelets are destroyed. Now, what are the signs or symptoms? I'm going to show all of the common symptoms, and I will give a green tick for the symptoms that Kai showed. So, the most common symptoms are fever, loss of appetite, weight loss, vomiting, diarrhea, constant licking, respiratory distress, neurological problems, behavioral changes, lameness, and in severe cases, rashes, hemorrhage, autoimmune and secondary infections, which can lead to death. Now, how deadly is ehrlichiosis? So, ehrlichiosis is divided into 3 stages: the acute, subclinical, and chronic stage. The symptoms that I mentioned earlier can be shown in the acute stage: fever, weight loss, vomiting, constant licking, respiratory distress, and etc. Now, if caught early and through the proper treatments, which I will also mention later on, the dog should recover. But then, there is the second stage. It is the subclinical stage, and this stage is considered as the most dangerous stage, because the parasite is still present, but your dog will not show any signs or symptoms, so no outward signs. Then why is it dangerous? Well, because most of us will think that our dog has recovered. Now some dogs do recover from this disease by their own. Some owners didn't even notice that their dog picked up the disease. But for some dogs, the symptoms are gone, but the disease is still inside. And the only way to diagnose the disease is by their blood sample. It is still very possible for the dog to recover through treatments, but if not diagnosed, this could lead to the deadliest stage, which is the third stage and the final stage, the chronic stage. In the chronic stage, the immune can no longer stand the disease, and the dog will show symptoms like rashes and hemorrhage or severe bleeding, particularly from the nose. This can cause anemia, and at this stage, usually the red blood count and the platelets will significantly drop. I also read that the low blood cell count is also caused by the failure of the bone marrow, which has the job to produce blood cells, the red, the white, and the platelets. This failure can cause many health problems and possibly death. Still possible to be cured, but it is still very dangerous. I am thankful that in Kai's case, he showed the symptoms clearly and was caught at the early stage. Because in some cases, the dog will not show any symptoms, still looking healthy because they're in the subclinical stage, and then poof, rashes, severe bleeding, and possibly death. This happened to one of my cousin's huskies, and also happened to one of the most famous and lovable Belgian Malinois in Indonesia, who was named Sparta, who is also owned by a famous and lovable person in Indonesia. Sparta did not show any early symptoms that I mentioned. Seemed very healthy and energetic as usual. And suddenly rashes started to show, severe bleeding, and finally everything turned into a nightmare. Diagnosis and treatment. If you think your dog has the symptoms that I mentioned, take him to the vet for further examination. Kai did the blood work and a rapid test. The rapid test was for the detection of antibodies to erlichiosis, which Kai tested positive, and the blood work which resulted his platelet count, RBC or the red blood cell count, is quite low. The vet told me that this indicates that he got erlichiosis and most likely in the acute stage. The treatment that my vet gave was antibiotic medication using tetracycline. Some vets also use doxycycline as well. It's an antibiotic, so it is a long-term medication, but you shouldn't give this medication without your vet's permission and advice. Different dogs have different cases, so the treatments will be different as well. In severe cases like hemorrhage, blood transfusion will be necessary. So now, how can we prevent erlichiosis? The only possible way you can prevent this from happening is through tick control. We never know whether the tick is infected by some kind of disease or not, therefore we should take tick control seriously. I used anti-flea products such as anti-flea shampoos, flea powders, but apparently it didn't work well. Now if I trace back, there are many possibilities on how Kai got his ticks and fleas. Could be on our walking sessions, his time at the park or fields, because he really likes rolling and lying on the grass, so yes, anywhere is possible. So do consider giving your dog anti-flea chewable pills or anti-flea collars, and always check for fleas and ticks. They can hide anywhere from between your dog's paw, inside their ears, underneath their collar, and pretty much anywhere. For ticks and fleas are responsible to many diseases such as erlichiosis, babesiosis, Lyme disease, anaplasmosis, and still many more. I never thought this could happen to Kai, because I thought I've done enough tick control. But reality shows that I haven't done enough to keep him safe. At the moment, Kai seemed a lot better right now. Not lethargic, started to eat well, but his legs are still a bit weary, still constantly licking his lips, and the vet says we should keep an eye on him, even though it seemed like he got better. Few more days we are coming back to our vet to check on his progress in terms of red blood cell count and platelet count, also for further observation. I will be back maybe next week with a new update, and I really hope it's a good news update. Now before I end this video, I really want to know if your dog ever got infected from erlichiosis. So please, if you have this experience, kindly share in the comments down below. Or maybe you know something else. Share it also in the comments. Everything goes. Thank you guys for watching. I hope this information helps. I'll be back with updates and wish us luck. Goodbye.